Claire was in so much pain that she could do nothing but scream at the top of her lungs.
There was always that question of why is all this happening? What's wrong with my mom?
I was totally desperate for some kind of answer.
I was just so scared that I was going to have to stay in the hospital forever.
Beth and I were not sure where to go at all. We were completely lost.
Next, two medical mysteries that defied the experts.
From the day she was born, the mysterious birthmark on Claire Manty's face has been randomly changing color. But no one could have ever imagined that the tiny spot is actually a sign that will change the little girl's life forever.
The toughest part was realizing that we may be dealing with something life-threatening.
Then, Lynn Sanders could have never imagined that the bizarre, inexplicable joint pain she's endured since she was 15 years old would ever jeopardize her life or her baby's.
All of a sudden, I felt no movement. I was thinking, I'm going to have a stillborn, or there's something wrong with my daughter.
When Beth and Ryan Manty first laid eyes on each other in a Green Bay, Wisconsin pizza parlor, it was as close as it gets to love at first sight.
It was an unbelievable moment. I remember it like it was yesterday.
Still, little did either of them know that just a few years later, they'd be tying the knot.
We got married in June of 1990, and we're looking forward to starting a family.
They tried for nearly a decade with no success, until one day in the spring of 1997, their luck suddenly changed.
That morning was no different than any other than I knew it the second she walked out of the bedroom and I saw it in her face that she was pregnant. It was the greatest morning ever.
Brian and I were very excited, but nervous.
Beth's pregnancy goes off without a hitch until 2 weeks before the due date when her water suddenly breaks.
It was late at night. We gathered our stuff and raced to the hospital thinking that it was going to happen any moment.
At the hospital, Beth is hustled into a birthing room. But just when it seems she's about to have the baby, her labor stalls.
The contractions were getting further apart instead of closer together, so the baby would slip back up.
The doctor soon determines that the baby's head is lodged behind Beth's pelvic bone. Using a vacuum extractor, he carefully applies pressure to pull the baby out.
It was scary. It seemed to take a really long time.
Finally, 12 hours after arriving at the hospital, Beth gives birth to a baby girl.
The biggest thing I remember is telling Beth that it was a girl. Our family had never had a girl.
Claire Rose Manty weighs in at a healthy 7 pounds, 14 ounces. But right away, the parents can tell that something is very wrong.
The left side of her face was really swollen up.
There was bruising around the left ear, the cheek on the face, underneath her jawline, and what appeared to be more purplish area that was possibly a birthmark. The doctor reassured us that the bruising should resolve along with the swelling within the first couple weeks of life, and the birthmark would get lighter as she got older.
It's so much better when all that swelling goes down.
3 days later, Beth is discharged and the new parents take their daughter home. Over the next 4 months, Claire's bruises slowly heal and disappear, but the purplish birthmark with its strange bumpy texture remains as clear as the day she was born.
I wasn't so much worried about the mark on the side of her face. I guess I was just more happy that she was healthy and seemed to have 10 fingers, 10 toes.
But when Claire is about 6 months old, Beth and Ryan can't help but notice that something seems to be bothering their little girl.
She would reach and pull and tug at her ear. We could tell that she was probably in some ear pain.
Alarmed, the Mantys take Claire in to see their family physician.
And that's when they started to notice an infection in her ear and put her on antibiotics. It would be 2 or 3 days before the antibiotic was completely working for her and she was feeling better.
But it's not long before Claire starts to show signs of pain yet again.
I was mentioning to the doctors that she was having what seemed like these pain episodes.
They always said that she had a sinus infection or an ear infection or just a cold.
Over the next year, Claire is plagued by frequent infections, which appear to be linked in some way to the birthmark on the left side of her face.
We would first notice the change in behavior with Claire, that she became moody and cranky. And then we would notice that the birthmark would become more pronounced or visible. And then there would be sometimes a slight swelling that would occur, and then the pain would follow shortly after.
The Mantis grow increasingly concerned and puzzled, but while the doctors assure them that there's nothing serious to worry about, the pain and swelling begin to spread across Claire's face.
As she's getting older, she's able to let us know that she's still having pain episodes, and pointing to her jaw and just in general the left side of her face, not particularly her ears.
She'd scream and yell and wail until somebody, would hold her, rock her, pick her up.
The doctors were telling us that she was just a very sensitive kid, that she was dramatic. The doctors were thinking that maybe she was getting social enjoyment out of the doctor visits. Ryan and I knew that there was underlying pain issues.
Sometimes I thought that I would just have this pain forever and would never go away.
I felt helpless. My friends didn't have the same problems with their kids. I was concerned that there might be something else going on.
Then, shortly after Claire turns 5 years old, she takes a sudden turn for the worse.
My temperature kept getting higher. My face got swollen.
It looked like she had stuffed her left cheek with marshmallows, but it was a little bit lower on the face. It was down in the neck area. She was being totally nonsensical. She didn't know where she was. She didn't know who I was.
I think a little bit of my wife died that day.
In the spring of 1974, 15-year-old Lynn Sanders had a reputation as one of the best swimmers in the small Wisconsin town she grew up in.
I medaled in the Parkland Conference when you swim against all other high schools, and I took 3rd place in breaststroke, which I was really proud of.
But one afternoon, as she's gliding through the water, Lynn starts to feel something she's never felt before: agonizing pain in her hands.
It was really uncomfortable, achy, like I had the flu or something.
Lynn describes the strange soreness to her mother, who insists on taking her in to see the family doctor. He immediately assumes that the teen has broken a small bone in her hand from the strenuous water workouts. But after taking an X-ray, nothing appears out of the ordinary. The doctor chalks her aches up to growing pains and encourages Lynn to keep her hand wrapped in a support bandage whenever the pain flares up.
Kids are always asking you, why are you wearing that? So you have to explain a story that I just sprained myself. I didn't want to let them know that the doctor just said it was growing pains.
Worse still, as the weeks drag on, the pain in her wrists does not get any better. In fact, they eventually become so tender that she can no longer keep up with the grueling swimming workouts.
Basically, the pain forced me to quit. It was very difficult to quit the swim team, and my parents were disappointed.
Despite the strange looks she keeps getting from classmates, Lynn does her best to just live her life like a normal teenager. She starts going to the local roller rink after school, hoping to make new friends.
It was boys' choice, and I asked her to skate, and we ended up going on another date from that.
During the dating years, I would mention every once in a while that my hand or shoulders were hurting, but I didn't really want to keep mentioning to Dave about all my pain because I didn't want to chase him away.
By the time her senior year rolls around, Lynn is living with chronic pain 24/7. While Dave is essentially unaware of what she's going through, he does notice that Lynn has a propensity to hurt herself.
He would call me klutzy. He would see me do klutzy things.
But nobody realizes just how bad her situation has become. In fact, Lynn's hands have gotten so sore, she's starting to have trouble performing even the simplest of tasks.
I really did feel alone. My mom would tell me to just wrap it up with a bandage and, it'll be better in a couple weeks.
Weeks, then months go by, and the relentless pain doesn't let up, despite the fact that she's wearing the hand braces and taking aspirin 4 times a day. Then, right before graduation, Lynn notices something very unnatural while she's going through her morning stretches.
My elbows looked different. They rotated weird.
I was not aware that Lynn had hypermobility of her joints. It wasn't something that she shared with me or really anyone.
But soon after the young couple gets married in 1978, Lynn can't hide her condition from Dave any longer.
I worked at a daycare. I had a hard time lifting the 2-year-olds. I could feel my shoulders starting to pop out, and I could literally hear it pop.
And it would actually, what they call wing out. It would almost separate from where it's supposed to lie and lie flat.
I would get horrendous pain.
When she can't take it any longer, Lynn quits the daycare and takes on a more low-key desk job. But the daily repetitive office tasks soon begin to take a toll on her as well.
It was getting harder for me to button my buttons on my blouse, turn doorknobs, lift up things with my hand.
Finally, Dave insists that she see an orthopedist to find out once and for all what's wrong with her.
Basically, he comes in the x-ray room and he pulls my hand and separates my wrist during the x-ray, and no other doctor ever did that.
Next, he gives her an extremely thorough exam and even has her perform a series of manual exercises to see how her bones react to movement.
When he was doing the stress test, it was really a horrendous pain. My hand bone basically separated a lot from my wrist bone.
The doctor explains that Lynn's fragile ligaments are so stretched out, they're literally unable to keep her bones in place anymore. This allows the dozens of bones in her hands to rub up against each other, causing friction and excruciating pain.
My ligaments were stretching out, and he needed to shorten those ligaments up. He decided that he could do a surgery.
Desperate to make the pain go away, Lynn agrees to the surgery. And 2 months later, she feels something in her hands that she hasn't felt since she was 15. Nothing.
The wrist felt so much better, and it made me feel 10 times better knowing that this doctor actually, I believe, got down to the bottom of the problem.
Over the next 4 years, Lynn undergoes 7 surgeries on various joints. It's the only way she's able to keep the pain at bay.
Again and again, it was one joint and another. One would get patched up and fixed up, and then 6 months later, it'd be a different joint that we had problems with.
Then in 1981, Lynn finds out she's pregnant. At first, she and Dave are overjoyed. But it isn't long before the throbbing pains return with a vengeance. And this time, they're not just in her hands. In fact, her entire body feels as if it's been battered.
The OBGYN said that you are stretching out and that you were going to have a little achiness from being pregnant. All my joint pain never subsided during the whole pregnancy. I didn't know what to expect, basically. I was scared.
Since the day she was born, 5-year-old Claire Manti has been suffering from bizarre episodes of facial pain that seem to coincide with the birthmark on the left side of her face suddenly changing color.
She would put her face up against your body and rub on it to try and soothe herself.
But now, Claire is sicker than ever before. She's spiking a fever, and her face is severely swollen.
She had a fever of about 104, was completely lethargic and limp, so we rushed her into the ER.
My ears felt like someone was sticking a Q-tip in and was just not letting it out. They were just touching my eardrum and pounding, and I could hear pounding in my ear. This was not normal. I never felt this before.
Alarmed, the medical team immediately administers a blood test.
Her white blood cell count was completely elevated, near 3 times what it should have been, and that it indicated there was some sort of major infection going on. It looked pretty obvious to be the left side of the face. They initially put her on some medication to help retain fluids because she was very dehydrated, and that's where the disorientation was coming from. And they gave her antibiotic shots every 4 hours.
Over the next few days, Claire's infection is gradually brought under control, but her face remains extremely swollen. The doctors now suspect that the inflammation near her jaw may be the result of a blocked saliva gland and order a CAT scan to find out for sure.
Waiting for the results was excruciating. We weren't sure what was going on.
Later that day, the findings come in, and the report sends Beth and Ryan reeling.
One side of the face, right down the middle, was absolutely fine and normal, and the other side looked like Swiss cheese.
Based on these images, the doctor concludes that Claire is suffering from fibrous dysplasia, a rare disease in which bone thins out and is replaced by fibrous tissue.
The doctor said there was no treatment. He basically said that it's something you're just going to have to live with.
So far, the disease has just affected Claire's jaw. But because fibrous dysplasia weakens bones, they are more susceptible to fracture over time. She won't be able to play any sports and will have to be monitored carefully for the rest of her life.
There was going to probably be some deformity in the bones that were affected. My main concern was what was going to happen to Claire's face as she hit puberty, the time when fibrous dysplasia really grows.
But while the fibrous dysplasia explains the facial pain that Claire's been suffering from for years, it doesn't account for the unusual birthmark or the frequent infections she's so susceptible to.
He told me that it just happened to be a coincidence that we found the fibrous dysplasia because of this unknown infection.
At this point, my wife is nuts. She can't even believe that this is all they're giving us.
It didn't make any sense to me that she had swelling in the exact same spot, that the bones were affected with this fibrous dysplasia. We had also noticed that Claire would periodically complain of random pains in her legs and her hips.
Determined to get to the bottom of things, Beth takes Claire to a new doctor in December of 2005. He gives the little girl a thorough exam and reviews her history, including the previous CAT scans of her jaw.
The doctor ordered a full body x-ray at that point and to find out where else she may have bone involvement.
The new films reveal that the fibrous dysplasia is beginning to erode other bones in Claire's body, her forearm, hip bone, several ribs, and the top vertebra of her neck.
Ryan and I were concerned. It was very scary.
These findings, coupled with Claire's strange birthmark, are important clues for the doctor. He believes that she's suffering from McCune-Albright syndrome, a rare genetic disease that often sets in during childhood.
Fibrous dysplasia was one of the symptoms of McCune-Albright syndrome, along with having a birthmark near her jaw where we know she has the bone involvement. At this point, I'm excited that we finally have a diagnosis that seems to fit closer to what we've had experienced with Claire.
But the diagnosis is bittersweet. There's no cure for McCune-Albright. And in addition to bone degeneration, Claire will have to be monitored for possible cardiac complications associated with the condition.
I remember just thinking about Claire and thinking about our future and her future and not really knowing what was going to happen next.
For the next year and a half, the family focuses on managing Claire's frequent infections and chronic pain.
Claire was in so much pain that she could do nothing but scream at the top of her lungs. The pain episodes would last anywhere from a couple of hours to a couple of days. At this point, we'd make an appointment at a pain clinic to help Claire better control her pain during these episodes. They did prescribe a narcotic for her to take when the pain was uncontrollable or not treated with over-the-counter drugs.
Desperate for help, the Manties attend a conference on rare disorders in August of 2007. At the event, Beth asks a McCune Albright specialist to take a look at Claire. But what he tells the Manties turns their world upside down.
The doctor examined her birthmark and stated that it was the wrong color, that typical birthmarks are coffee in color.
Claire's birthmark is a port wine color, while McCune Albright birthmarks tend to be more light brown in appearance.
The doctor told us he didn't think Claire had McCune Albright. I had no idea what we were going to find out.
The toughest part at this point was realizing that we may be dealing with something that is life-threatening.
Expecting for the first time, Lynn Sanders has been enduring debilitating joint pains that her doctor has repeatedly insisted are a natural part of pregnancy.
All my joint pain never subsided during the whole pregnancy, but I thought that was normal. After I delivered my son, I still had that achiness all over.
But before her body has any time to really recuperate, she finds out she's pregnant yet again. And this time, the agonizing pain seemed to have escalated to a degree that she has never felt before.
I thought because of hormonal problems, that would just continue until, your body gets back into normal shape again.
But 3 months after her second boy's birth, Lynn still isn't feeling any better. The pain is constant. She begins to realize that she can't have any more children in this state and goes on the pill.
And I think it was kind of a cranky mom at the time because of all the pain that I was having.
There was always that question of why is all this happening? What's wrong with my mom?
My knee pain was really, really a sharp pain at the time. I could hardly put weight on it.
When Lynn checks in with her doctor yet again, he assures her that the crippling knee pain is simply a side effect of having paper-thin ligaments. The only thing that will help is another surgery. The next day, Lynn is wheeled into the OR. But as the surgeon inspects her knee, he realizes that the damage is far more extensive than they first thought. After completing the complicated surgery, he instructs the team to put her in a full leg cast to help stabilize her fragile knee.
I was thinking, how am I going to take care of 2 young kids with a cast this size where I can't bend my knee?
After 8 days of recovery in the hospital, the surgeon discharges her with strict orders to take it easy. But Lynn is determined to get back on her feet as quickly as she can. And a few days later, she decides to give crutches a try. But as soon as she takes her first step, she notices that something isn't quite right.
I was having a little bit of pain in my calf area, which was kind of unusual because he fixed my knee.
The pain is just getting worse.
By the next morning, her calf is throbbing so badly that Dave insists on driving her to the emergency room. All it takes is one look at Lynn's leg, and the ER doctor knows that she's in serious trouble.
I was very terrified. I didn't know what to expect.
The medical team runs a battery of tests, and within an hour, they know exactly what's going on. Lynn has 3 blood clots in her leg. At any point, these clots could break loose and travel up through her blood vessels. If they lodge in a sensitive place like the lungs, it could kill her almost instantly.
It was, a very dangerous situation. I realized how quickly it could go bad.
They thought they could be from my birth control pills, so they took me off immediately.
Over the course of the next 8 days, they keep a close eye on Lynn as they pump her full of blood thinners to help reduce the deadly clots.
I just couldn't believe I had to go back for another 8 days.
When the team is confident that the young mother is no longer in danger, they release her with a 90-day supply of the blood-thinning medication. Lynn and Dave are hopeful that the worst of it is behind them. But 2 months later, Lynn is caught off guard when her body starts to change again.
I discovered that I'm pregnant.
She's in a full leg cast, and somehow or another we managed to, do what young couples do, and she ended up getting pregnant.
But the real shock is yet to come. On hearing the news, the doctor recommends that she terminate the pregnancy. He's concerned that the blood thinners she's been taking could have already done serious damage to the unborn fetus.
Also, they said I could miscarry because of it.
She was pretty broken up about it, and I was just trying to be there to listen and try and understand what it was we were going to do next.
Lynn immediately stops taking the blood thinners and begins researching her risks. When she contacts the March of Dimes, they refer her to Luann Week, a genetic counselor.
We had some uncertainty about the exact timing of her pregnancy and how far along she was. We really have to pinpoint that timing because it makes a big difference as to what the risks are.
The next day, Lynn goes in for an ultrasound, and they're relieved to discover that she's only 5 weeks along. This is good news because the baby was only exposed to the blood thinners for a brief period of time.
As we often say in genetics, nothing's 100%, and so we still had to manage and cope with the fact that there was some uncertainty here.
But Lynn is willing to take the very real risks, especially when she finds out that she's having a girl.
I just broke out in tears because I finally was going to have my girl.
During this third pregnancy, she was in constant pain.
I was in more pain than ever, and I was worried about the baby and if she would have birth defects.
The stress of it all is almost more than either of them can bear. But in the 34th week of her pregnancy, the couple finally hits rock bottom.
All of a sudden, I felt no movement. Here I'm thinking I'm going to have a stillborn, or there's something wrong with my daughter.
Since she was a baby, 9-year-old Claire Manty has been suffering from severe facial pain, the result of what doctors believe is McCune-Albright syndrome, an extremely rare genetic disease that's slowly dissolving the bones in her body, especially in her jaw. But now one doctor is sure that Claire doesn't have the debilitating disease. It's a curveball that neither of her parents was expecting.
Beth and I were not sure now where to go at all because we were completely lost at this point.
The doctor immediately refers the Mantys to the BerthMarks and Vascular Anomalies Clinic at Children's Hospital of Wisconsin. In February of 2008, the family meets with a team of specialists led by Dr. Beth Drolet.
We knew a lot about Claire because we had volumes of her medical records. We had looked at her CT, and we had looked at all her imaging.
After performing a thorough head-to-toe exam, Dr. Drolet and her colleague, Dr. Michael Kelly, focus on the spot the pain seems to be emanating from, Claire's jaw.
Normal bone is usually very hard and non-tender when you feel it. Claire's bones were a little softer. The recommendation of the group was to biopsy both the jaw and the forearm. We wanted 2 different biopsies to maximize the likelihood of obtaining the correct diagnosis during one operating room visit.
We were nervous about doing the biopsy on her jaw because there was so much destruction of her bone. Even on the CT, it just almost looked like paper.
But the surgeon is confident he can get Claire through the procedure safely. And 4 days later, she's wheeled into the OR.
My worst fear was that we were going to lose her, or something medical related was going to stand in her way of becoming what she wanted to become.
An hour later, the medical team pronounces the procedure a success.
After the procedure's done, the specimens are sent to the lab, and the pathologist will take small pieces of the bone and slice them very thin and look under the microscope.
But when the findings come in, they're nothing short of shocking.
The bone from her jaw had several holes in it, kind of punched out holes, and the pathologist likened it to if you take a candy cane or a piece of candy that you suck on, there's these little holes throughout the area. Based on the pathology results and collectively as a group, our diagnosis was lymphangiomatosis.
Lymphangiomatosis is a rare and complex disorder of the lymphatic system. In healthy patients, fluid containing white blood cells moves through the body in lymphatic vessels and attacks infections. But in patients like Claire, the lymphatic vessels don't work properly. They grow uncontrollably and in parts of the body where they're not supposed to be. As a result, research suggests they can destroy healthy tissue, organs, or bones and disrupt immune function. The cause is unknown, and to date, there is no cure.
Lymphangiomatosis is a disease in which different areas of the body can be affected by abnormal collections of lymphatic vessels.
Claire's disease is in her bones. What we think happens in kids that have lymphangiomatosis is that during development, there was some kind of disruption as the lymphatic vessels were forming. So they have too many, and they're too big, and they're dilated, and they don't work properly.
Although we think of bone as permanent and static, in fact, bone is continually replenishing itself, dissolving and then reforming. In a healthy individual, there's a balance between the cells that make bone and the cells that destroy bone. But in patients with lymphangiomatosis, the presence of abnormal lymphatic vessels overstimulates the destructive bone cells. As a result, the balance tips in favor of bone destruction.
Her jawbone is probably 10 to 20 times thinner than it should be.
But while Claire's jaw is the most affected, other bones in her body have also been ravaged by the disease.
She has lymphatic destruction of her left mandible, the base of her skull, which is kind of back here, the bones of her skull. She has it in her right arm. She has it in her pelvis. She has it in many areas within her spine. She has a few lesions in her rib as well.
With a diagnosis in hand, all of Claire's puzzling symptoms now make sense. Dr. Drolet explains that the disease revealed itself as soon as Claire was born, in the birthmark on the left side of her face.
The birthmark is from abnormal or excessive lymphatic vessels that are within the very, very superficial layers of the skin. Typically, if there is an infection in and around an area where you have abnormal lymphatic vessels, the lymphatic vessels will dilate, they get swollen and inflamed and red. And if the lymphatic vessels are in the surface of the skin, as they would be in a birthmark, you can actually see them swelling, they turn bright red.
Lymphatic vessels are supposed to fight off infections by transporting lymphocytes, or white blood cells, to the source of the infection. But in Claire's case, the infection-fighting process is disturbed.
Because of the abnormal lymphatic vessels, we can assume that she probably was much, much more susceptible to infections.
The infections, in turn, caused her lymphatic vessels to become inflamed, which ultimately led to the swelling in her face.
When the lymphatic vessels are deeper underneath the skin, the fluid kind of builds up in those vessels and causes swelling.
The chronic pain was a direct result of the unique manner in which her lymphatic vessels affected her bones.
Bones grow in response to pressure, and so the vessels actually cause increased pressure kind of from the inside out, and that's actually one of the things that we think might be causing some of the early symptoms of pain.
Although the diagnosis helps explain Claire's mysterious medical history, nothing could have prepared the Manties for what the medical team says next.
Most of the complications come from in and around the ribs, and the ribs can break. But also the lymphatic vessels can expand into the tissue surrounding the lungs, and the lymphatic vessels contain a lot of fluid, and that fluid begins to leak in and around the lining of the lungs and can collapse the lungs.
One part of me felt relief that we finally knew what it was. The other part of me was absolutely terrified.
Progression of disease can occur over years or decades, resulting in fragility of the bone or fracture of the bones. Or it can be very sudden, where patients can die.
Most of the people in Lynn Sanders' life think she's a klutz. They have no idea that the 28-year-old has persevered for more than a decade with chronic and debilitating joint pain.
I had neighbors actually making fun of me, saying, well, what are you going to have a cast on this time?
Then, during the 8th month of her 3rd pregnancy, the baby stops moving, and the young mother knows she needs help.
I immediately went to my OBGYN. He told me that I was in labor, basically, and that I was going to have the baby 6 weeks early.
It's a tense 6 hours of labor, but on March 18, 1986, Jessica Sanders is born. And even though she's premature, doctors assure Dave and Lynn that she's perfectly healthy. But Lynn is still very worried that the blood thinners could have affected her baby girl in ways that aren't yet apparent. So she checks back in with Luann Week, her genetic counselor.
I asked her lots of questions about Jessica's medical history, and every question that I asked had a very normal newborn baby answer.
Just to be safe, Lynn continues to take her daughter in to see Luann every 6 months. And each time, she assures the nervous mother that all is well. At Jessica's 3-year checkup, it becomes clear that the genetic counselor is far more worried about Lynn than her daughter.
Luann asked me, every time I see you, you're in a different cast.
So started asking her a lot more questions about her health history. I felt it was important that I make her aware of a condition that might explain her problems.
Lynn can't believe what Luann is suggesting. She spent nearly 15 years hearing that she's just different, but secretly, she's always suspected there was more going on.
I was totally desperate for some kind of answer to all the aches and pain that I had since I was 15 years old.
Luann advises Lynn to get in touch with a genetic specialist immediately. She tracks down Dr. Pamela Trepane and hands over her extensive medical file. Dr. Trepane begins conducting her own investigation by having Lynn perform very specific tests on her joints.
There is a scale that we use to be able to assess joint instability and joint hypermobility.
In other words, how mobile are her joints? Looking at her skin, how stretchy it is.
Based on that type of a physical exam, in addition to her medical history, makes that diagnosis. Lynn has classic features of Ehlers-Danlos syndrome.
Ehlers-Danlos syndrome is a disorder in which a genetic mutation disrupts the patient's production of collagen, a type of protein that acts as a glue and holds our skin, muscle, and ligaments together. Without the adequate collagen, Lynn's body quite literally began falling apart.
Lynn's joint pain is a direct result of the poor collagen and the poor elasticity. Many children, their parents will describe them as being clumsy, when in fact they're trying very hard to keep their whole body in appropriate alignment.
You think back and think, well, maybe she wasn't the klutz that we thought she was. It was related to this condition that she had no control over.
Dr. Trepane speculates that Lynn's pain progressed slowly from her hands and wrists to other body parts because the joints that are used most often feel the wear and tear first.
When Lynn was pregnant, she felt even more fatigued. We're already talking about joints that are unstable, and now you're adding the load of the pregnancy on top of that and a shifting center of gravity. All of those things then will combine to create increased joint pain. Historically, people who had classic Ehlers-Danlos syndrome had incredibly stretchy skin. Within circus environments, you see the people that can stretch their skin, taking their earlobes and pulling them down.
One of the big puzzles, of course, for Lynn was why it took so long for people to make this diagnosis.
She did not have overly stretchy skin. Unfortunately, what most physicians have learned is that's EDS.
While it's reassuring to finally know what she's been living with all these years, Lynn is not prepared for what the doctor has to say next.
There is no cure for EDS. We cannot go in and fix the gene that is making the collagen incorrectly. We can, however, provide good pain control and good physical therapy.
Lynn begins a rigorous course to strengthen and steady her joints and takes prescription medications to help manage her pain. Unfortunately, she will continue to require surgeries to tighten up her ligaments as they wear out.
I'm trying to go and do the best I can each and every day. Every day is a new day.
After suffering from inexplicable and often harrowing facial pain since birth, 10-year-old Claire Manty has just been diagnosed with lymphangiomatosis, a rare and potentially life-threatening disease in which the body destroys its own bones.
Brian and I were really overwhelmed with what we had been told.
My parents told me it can spread, it can go to my lungs, and that's what can cause you even to die. And I got really scared.
It is almost impossible for us as physicians to be able to predict her prognosis. It's very rare, maybe less than 200 cases reported, and really are just beginning to understand what happens to these kids over time.
And although researchers are busy working on new treatments, their side effects remain unknown.
Currently, there is a new clinical protocol that is being developed using experimental agents to treat patients with abnormal lymphatic growth such as lymphangiomatosis. We will recommend Claire for this clinical trial.
In the meantime, the best the medical team can do is work to manage Claire's pain and keep infections to a minimum.
We are aggressively treating any pain with antibiotics in hopes of decreasing the aggressiveness and the swelling of the lymphatic vessels with infection.
The doctors will also need to regularly monitor Claire's fragile bones with x-rays and CAT scans.
We want to get an idea of how fast Claire's bone destruction is progressing. Is it stable or is it getting worse?
Although the Maddies are relieved that Claire's finally in good hands, they can't help but wonder why it's taken so many years to get a solid diagnosis.
Claire was initially diagnosed with McCune-Albright syndrome as well as fibrous dysplasia of the bones. Both of these are rare problems, and one can be associated with the other. However, Claire's findings on X-ray were really inconsistent with this particular problem.
The symptoms are so vague, pain, headache, ear infection. A lot of kids have tons of ear infections. All you can see on the X-ray or on a CT is that the bone is just disappearing, but you don't really know the process. So it often takes years before these kids are diagnosed.
As a dad, you have dreams of what your kids are going to do and what they're going to be, but it hurts not knowing what she's going to have to deal with growing up and going forward in life.
Today, 9 months after being diagnosed, Claire is doing well and is determined to live a full and active life, at home and on the stage.
I like to sing and act. I've been in 2 plays.
Time with Claire now is more precious than ever.
They've told me that it's going to be there forever and that it could get worse and it could just stay as it is right now. All we have to do is just pray and hope that it'll get better.
To date, Lynn has had more than 40 surgeries. She also wears custom-made silver ring splints to help stabilize the joints in her fingers.
I wear these just to prevent tearing in my ligaments in my fingers, and also it really does help with pain.
Lynn is still coming to terms with the fact that her disease will never go away. But she finds her inspiration to face each day through her husband's unwavering support.
It takes a special person to marry somebody and still stand by my side. 33 years since we met.
It's for better or worse than sickness and health, and that's pretty much what I've stood by.
Today, Dave and Lynn remain hopeful for a cure. In the meantime, she's doing all that she can to help patients like herself. In 2006, she started the Ehlers-Danlos Syndrome Network Cares.
You have to be your own advocate. I hope someday every doctor knows something about Ehlers-Danlos syndrome.